good evening to everybody. I am very happy to introduce Dr. Veena. It's one of my good friends. And also, I would like to introduce the Archaeo Fortnight program. And as you know, we have already started the Archaeo Fortnight program for celebrate the National Archaeology Day, which falls on 7th July. This is the 131st National Archaeology Day of Sri Lanka. In this year, it comes. And we started Archaeo Fortnight program from today itself. Today morning, we started at 9 o'clock with celebrations and greetings sent to us by various scholars all over the world. And then we formed a Archaeo Youth Club with several young buddy archaeologists. And now, and in the evening, we started a workshop series on monument conservation. And that kind of workshops we are going to start even in the next few days. One is on epigraphy, one is on coins, and one is on digital literacy in archaeology, and one is on science and archaeology. And that type of workshops will go on for 6 months or so, continuously. And some of you, I mean, all of you can join those workshops free of charge. And along with this program, we thought to start an international lecture series. And this lecture is the first lecture of that international lecture series. We termed it as the Archaeo-Hour lecture series. In Sinhala, we do it, we call it a Pura-Paya lecture series. We already started a Sinhala lecture series, but this international lecture series is going to be started with Dr. Veena Mushrif Tripathy, and she's here. We call her Smiling Veena. It's always smiling, so you can see it. She's smiling even now. So therefore, she's well known as the Smiling Veena. Anyway, before I come to her, I'll brief about the Archaeo Fortnight program. We are going to declare open tomorrow with Honorable Minister Vidura Wickramanayake, and also possibly our Prime Minister also will be participating in tomorrow's program in Kurunegala district. We go to several places, and the key function will be at Panavitiya Ambalama. There we are going to declare open an information center tomorrow. And the day after tomorrow, we have some workshops, and we are going to have a poetic evening in one of these days. And for that, some of the well-known poets of Sri Lanka join us to review our poems, and that will be one of the key events of this Archaeo Fortnight. And also, we are the most important day, the National Archaeology Day, will be celebrated at the Prime Minister's residence in Sri Lanka on July 7th with Honorable Prime Minister, and also the President, His Excellency President will be participating in it. But most unfortunately, due to this pandemic situation, only a few and a limited number of people will be there during that day. But however, during that day, we are going to honor some of the young archaeologists and our employees who discovered new findings and also have done great service during last 6 months, and some service honors we are going to give them. Thereafter, one of the most important thing is that we are going to set up Archaeo Friends Club, that you all can join it. And then we are going to set up Archaeo Kids Society also. I think you can't join it because you are not a not kids, but your children can join it. We aim school kids for that. And also one of the most important thing is, Veena knows it very well, that we had International Association for Asian Heritage. We formed it several years ago. Veena is one of the founder members, but last few years we couldn't work properly, and it's rather, we can say it's inactive, but we want to re-establish it during these 2 weeks, and we can meet regularly after we reform it, and after this pandemic is over. It will over soon, I hope, and then we will meet. Yes, a lot of our friends from abroad, they can come here to Sri Lanka to work with us, and we also can go there. And we are planning to send almost everybody, every employee of my department, to foreign countries, even for a shorter period, to work with them. And we are also planning to invite some of foreign scholars to work with us in Sri Lanka, especially students. We would like to have some training programs. We are going to declare 2 sites as teaching sites and during this Archaeo Fortnight. And that also will be most important thing. And then we would like to invite foreign students, at least 5 students from SAARC countries, to train in Sri Lanka. And some of the well-known scholars from abroad can come and join us as teaching faculty for short courses, like Dr. Veena. She has already come to Sri Lanka for 3 or 4 times, as I remember. So this is the Archaeo Fortnight program. And today I'm not going to take you much time. I will introduce Dr. Veena. Actually, I forgot her topic properly. She will self-introduce herself and also about her topic. Whatever is, I think it's related to a skeleton, because she's always talking about skeletons, and she loves skeletons than us. We know it perfectly. And she's one of the great scholars on skeleton studies in the world. And she's number 1 on that subject in South Asia, no doubt about that. And she has produced several students also. She studied archaeology at the Deccan College, where I myself privileged to did my master's about 3 decades before. She was a little bit junior to me, and I never met her during that time, fortunately or unfortunately. But I met her a little later as a scholar, when she was a lecturer at Bandara in Baroda University. She organized, she's one of the organizers of the Buddhist conference in Baroda at that time. So I was one of the participants. And Professor Mapa was also there. Professor Veer Singh, I think they are here now. Otherwise, they were there. So then we became very close friends. And she came to Sri Lanka also. She took part in our SOSA conference in 2010, as I suppose. It's 2010. And then she came to the International Association for Asian Heritage conferences 2 times to Sri Lanka. And she's well known for her subject, and she's an expert on skeletons, remains, and we need her help and support to work with our Dr. Lanka Ranavira and Dr. Chamalina Halage. We have also 2 experts. I think they joined us today here. And I'm not going to take much time. Now I would like to invite Dr. Veena to deliver her lecture. Veena, you can introduce your topic, and also you can introduce yourself a little bit, and then you can start your lecture. Thank you very much, Dr. Veena. It's over to you now.
Yes. Good evening, everyone. I am really honored by the invitation by Department of Archaeology, Sri Lanka, and Professor Anura Manatunga. As you know that I have been there, and it is a great pleasure to talk to you guys again, talk to all of the through the digital platform. And I guess after my lecture, there will be some students or some faculty will be interested in my topic, and we can have some collaborative projects in future, which will be helpful for both the countries. With this, I will share my screen with you so that please let me know whether you are able to see my screen.
Yes, we can see.
Yes. Yes. Okay.
Yes.
Thank you. So as as Professor Anura Manatunga said, that I work with the skeletons, and that is what I do for my living, and I really love my subject. And today I will just talk about a little part, small part of that skeletal studies. It is called as paleopathology, and how we can use that tool to understand the human societies, past human societies. So that is my topic today. I will be dealing with, I will be talking about what is paleopathology, what are the different sections within that, as well as after that, I will give you a little bit about what kind of studies we have done in Indian context. So that is all my presentation will be covering these parts. So when we talk about paleopathology, it is a study of ancient diseases. Like every society or every individual goes to certain pathological issues, maybe small like fever to tuberculosis to any. So all these things are, if it is prolonged, if it is chronic, it get imprinted on human bones. So this paleopathology is basically that. It is studying of the history of the diseases, what kind of, like for example, corona, if you see today, in today's context, like recently there was a news that the corona-like infection was kind of identified some 20,000 years ago, which needs to be kind of look into the, so how the things have been changed, because we share a very relationship, like very strong relationship between the viruses or bacteria, because we get exposed to different bacteria and viruses in the surroundings. So how it is reflected in the, and that's why we get adapted also to that particular environment. So like for example, malaria. So malaria prone areas have this sickle cell anemia, which is good for the fighting against the malaria, but again it creates so it has a very strange relationship with the pathology. So to understand, so through the pathological journey, we can identify how this human societies reacted to different pathologies or different diseases, and these evidences are seen on the boards. So this is, when we talk about the scope of paleopathology, we have to discuss, so there are certain stages. So the first stage is we have to identify what kind of pathology, what kind of disease that person, that individual had. So that is known as a diagnosis. So you diagnose that. Okay. Then how the lesion is formed, how it looks like, what are the reasons behind it, what are the nature of bone changes, whether it's a inflammation or whether it's a porosity, or whether these are the things which I will be showing you in next slides. So the diagnosis is important, the kind of observations you do, so to know the exact problem of the bone, and then what is the reason behind it. So for example, as I was talking about the malaria, or the malaria is where it's because of the mosquitoes. So the mosquito, the area which has full of mosquitoes will always have these kind of a fevers and other problem related to malarial infection. So what is the reason, or whether you are having certain kind of infection? So the surroundings, idea of surroundings is taken from those kind of evidences. So these are the areas, potential areas for anthropologists can contribute to archaeology, as well as to entire knowing about the process of disease. So there are different methods for that, how you can identify these kind of pathologies. One is microscopy and microscopy like histology, ACM like scanning electron microscopy, X-ray, CT scan, MRI. Now when we are now going further, so we can have CT scan, MRI. So MRI, these kind of tools are very expensive, and which is not readily available for archaeological specimens. So X-ray is okay for the initial stages. Then the bone chemistry like trace element analysis or stable isotope analysis. The newly welcome tool is DNA sequencing or the ancient DNA. So that also depends on the survival of DNA. As everybody knows, like this South Asia is a climatic wise, it's not a very good area for preservation of DNA. So we have to really be very careful about what we are talking from the evidence of DNA. Then archaeological evidences or literature, literature like epigraphy, iconography, drawing, like you have Sigiriya that drawings, paintings are there. So in that, or maybe several other paintings from where we can get certain glimpses about any diseased person. Maybe there is a portrait of any diseased person or any person having some kind of, pathology. So that can also be identified, or that can be also used for the paleopathology. So these are the things are how we go with the paleopathology. So it requires interdisciplinary approach and a lot of other like chemistry, physics, and even the literature. All things can come together and contribute to this particular field. Although we can talk many things about pathology, but paleopathology, but there are a lot of restrictions on when we try to interpret those. The mainly thing is the pathology or the bone changes are only seen or only visible when the problem is prolonged. So there is a kind of a contradiction or in the paleopathology, like if in no bone changes or no pathology is seen on that particular individual, whether that particular individual is a very healthy individual or whether he died because he or she died because of the sudden kind of problem. So this is a very so you need to have a prolonged, you should have this prolonged sickness, then only you will get some indication on the bones. And the bones, it is very difficult sometimes to identify particular infection or particular pathology, because bone can give us very little indications like porosity, new bone formation, or any inflammation, or very few ways it can portray the problem. So these are the things. So that is what the bone is produce limited ways of reacting to the certain every pathology. So we have to literally try to dissect everything and then try to come to the conclusion why this particular bone changes and why it is there. So other than that, there are certain called as a pseudopathological. So as you can see here, there are like these are the marks which is done by the animal activity, or this is by the root. This is a proper green cremation marks. So these things are literally get confused sometime with the pathology, whether we are very confused sometimes that whether we should put it in the pathology section, or it's a pseudopathology or taphonomical. So pseudopathological generally means the taphonomical, which is once the body gets buried, there are a lot of other activities take place like soil, water, then the rodent and everything. So all this changes the bone. This is known as a taphonomy. So we get really confused sometimes. Some lesions are really confusing, but in this case, we are very sure this is done by the root activity, and this is a porcupine claw marks, and this is the tooth marks of the porcupine. So this is how we can identify. So for our understanding, our purpose, we categorize these pathological lesions into several subgroups. So one is congenital infection, trauma, joint. So I will be dealing one by one in a next slides. So when we talk about congenital disease, means when the disease or the any anomalies which is formed during the pregnancy, like some kind of problems you can have, and therefore it is a congenital. And in archaeological specimens, we don't get extreme cases of congenital disease, because if the child is born with extreme, so either you will the evidence will be not preserved. So you get mild forms of many times mild forms of congenital disease, like spina bifida. So this is a sacral bone in between your pelvic girdle, and then this is as a spina bifida, which is known as, then this is a staphnate defect. It is not actually congenital, it is progressive formation. And trigonocephaly, like in this case, there is a sequence of the our skull has sutures, so like parietal suture or like sagittal or the coronal suture. So it has a particular way of joining the particular pattern. If that pattern is missed, then you have deformed skull. So it is a congenital issue. So this is a trigonocephaly which was found in Inamgaon. So this is one way of talking. Then this is incomplete neural arch. This is a vertebral vertebra. This is again few. You can see this is the first strip of one individual, where you can very well identify that the size and the shape is quite different from one another. So it is related to, it doesn't all the time goes to the very severe pathology, but it can create some issues. Like in case of this, the neural cord will get exposed to other elements, so it might be a little bit dangerous. But again, it is not so severe. Then you are having the infection disease. Infection disease is seen on most of the skeletal series, and it is very well documented in paleopathological literature. And it is very, there are two types of infection actually, which is known as a non-specific infection, and one is specific infection. Non-specific infection, where you can see that there is some issues there, but you cannot pinpoint why there is what kind of disease has led to these kind of bone changes. And there is something called specific infection, which means that you are having this, you can see like leprosy or tuberculosis or trypanosome. So a particular segment of the body and particular bone gets infected, and that is why we can identify those as a specific infection. So these are the two main criteria. So the non-specific infection is like this kind of inflammation on this is a femur bone, and you can see there is a swelling here, and this is a small fragment, as you can see from the scale. So we don't know exactly, but we have to document these kind of bone changes, irrespective of whether we are able to identify a particular infection or not, or in that matter the bone swelling or the porosity seen in the femoral ends. So this is a very newly born child, bone of newly born child from Nagaland, and you can see here there is a lot of very dense porosity, which is very abnormal. So most likely this is related to tuberculosis, but we are not very sure about it. Till now we have not yet said it is. So, but this is very consistent with that kind of a pathology. This is a specific infection where you can, there is a triponomal infection. Triponomal infection can be syphilis, can be so in general, or pinta or yaws. There are 4 types of it, but if we are not very sure which type triponomal infection is, so we just put it as a triponema infection. So these are the certain infection can be seen on the archaeological population. This is again one more case of trichonormal infection where you can see the very much destruction of the face. So you can see these are the very disturbed, or the entire the bone surface is eroded because of the infection. There is a hole here in the zygomatic or the cheekbone here. So this is how you can see, you can identify that this belongs to certain trichonormal infection. Then leprosy is that way little bit easier too, because all the extremities in leprosy, all the extremities of your body gets damaged. So you can see this is from the Balathal. This paper was published by Gwen and me, and this is actually is well-known case in paleopathology literature, one of the oldest leprosy case from Balathal, Rajasthan. And you can see there is a destruction of the nasal septum and then the maxilla and the palate portion of maxilla. So on that basis, we identified that this person had a leprosy. Then traumatic lesions, which means that this is because of some kind of a sudden trauma or sudden accident or soft tissue or anything like, sudden. So that trauma is also registered in the archaeological population. So this is the trauma by flat blade. This particular this case was documented by Professor Varimbe. This is from S. Pappinaikanpatti from Tamil Nadu. And here they have identified that there is a sharp blow to the occipital or the back side of your skull. And you can see the secondary bone formation here. And this is really interesting that after such a grave injury, the person lived for at least 2 to 3 months because of the secondary bone formation. So the society had that much medical knowledge and that much close connectivity with the people surrounding. So that's why they could able to keep him alive. This is a male around 50-year-old. So he was alive till at least 2 months after such a kind of a grave injury. And this is a typical call as a green stick fracture. Green stick fracture is mainly the young subadult, basically children, when their bone gets bent. So basically it is green stick, which if you try to break it, it is very difficult to break it. So it bends. So on that place, it is known as a green stick fracture. So you can see the angle had changed here slightly. This is the another bone of the same child. This is a very straight, but this is there is a bend here. So it is from Inamgaon, and you can see this is known as a green stick fracture. Then these are well-healed fracture. This site is Hariyajpur. You can see radius and ulna. Basically, we are talking about the lower part of hand. So it is completely broken down and it was healed. So in a not in a appropriate manner. So you can see there is a pattern where actually it's gone little twisted. So in this case, this particular individual might have smaller hand. And this is a tibia. This is from another side, and this is again tibia and fibula. Here also you can see there is a bone fracture here. So this is how we can identify, and we can identify whether they had some kind of a medical knowledge or not. Today, if something breaks down, if some bone is damaged, then the orthopedician they put it in a very proper manner. But if you don't have that facility, then bone, whatever the way, you can just tie up the bone and just keep it. So that's why bone has a tendency to grow whenever it comes close. So that's why they grow and they heal. So these are completely healed fracture, not unhealed fracture. This is a very interesting site called Rukun, and you can see this is the site where we identified the hailstorm was happened, and some people got buried under the hailstorm, and you can identify these kind of cracking patterns on the skull. So this is a very good evidence of trauma. Then the joint disease. Joint disease is basically when the body gets old, when it is overused, then it creates a joint diseases. So like for everybody knows that spondylosis or arthritis, these names are very familiar to you. So these are the kind of things comes under the joint disease. These are known as a degenerative pathology. Degenerative means obviously it's a natural process of bone to degenerate. At certain age, after certain age, the bone starts degenerating. So this is what we see in the joint disease. So in this way, you can see this is a mandible. Actually, the mandible is the only part which can be removed from the skull. And because of that, if there are very somebody kind of uses that joint aggressively, these kind of things change, these bone changes can be seen. Then there is a this is the atlas and axis. So it shows when the skull is moving, or this is related to the aging process. Again, this is a arthritic issue where you can see the bone lipping. This is known as a lipping all around the vertebral column, vertebral body. So this is what is the lipping or arthritic issues. This is a very good example of when the pelvic and the femur. So femur this is the femur, and the lipping you can see along the head portion. So basically when your pelvic and the femur or the lower the leg, it moves some, you can see in the older people, you get that kind of a problem of the moving of the leg. This is a very good example of a knee arthritis. Many people might be having a knee issue. So basically what happens is the bone starts growing all around the articular area, and it comes closer, and it becomes very difficult to move that particular part. So this is how the bone is attached to the femur, patella or the kneecap, and the tibia. So this is a very good example of knee arthritis. Then the metabolic disease are mainly when the child is growing. If the child or the individual is faced with certain prolonged issues like fever, malaria, or diarrhea or anything, so it has to be prolonged. So all this, because it is a child, so the bone is growing continuously. So you can see certain markers where you can see the growth has been, normal cell growth has been stopped, and after the recovery again so those are recovery lines. So for example, this is an iron deficiency anemia. Now it is they consider as it is mainly related to the sickle cell anemia. Sickle cell anemia, as I told you, like it's related to the malaria. So, and it is from the Inamgaon or the early agropastoral communities. So obviously these people might be living near the very crowded area, or near the vegetation and other thing, and because of the malaria, because of the mosquitoes, they might got exposed, and the children are very vulnerable. So they get easily affected by their surroundings. So this is the iron deficiency anemia or sickle cell anemia. This is a cribra orbitalis. Basically, we are talking about the the roof of the orbit. So this also is an indication of certain kinds of infection. And this is a dental enamel hypoplasia or localized enamel hypoplasia. This is a tooth of a child, which is somewhere around 2-year-old, 3-year-old child, 2 to 3-year-old child. And this was the enamel starts formatting cells, starts from tip of the root, tip of the crown, and then it starts slowly. During this time, it might have certain kind of issues, health issues, and because of that, the normal cell growth stopped. And again, after that, certain times it recovered and it started normal, but eventually it could not survive. So even this is known as a Harris line. Again, it is the same principle. The bone is growing, and because of the health issue, it stops. These are known as recovery lines. And after that, again it started, but again he could not survive. This tooth and the long bone, it's of the same individual, same child. So you can see it has been imprinted on bone as well as on teeth. This is one more child. This is newborn child, and we are whether even though we are said it is scurvy or vitamin C deficiency, it's most likely related to the tuberculosis infection. Then stress factor, which is again degenerative pattern, because you are using particular body rigorously, so you will have this kind of stress factor. What is mean by this is the maxillary sinusitis. This is actually the upper jaw, and there is an infection here, and it is known as a maxillary sinusitis. Maxillary sinusitis happens when this area has a sinus, means the empty space. So we have 5 empty spaces in our skull, in our facial structure. So while inhaling, if we inhale, if we inhale the impure air, particles, they sit and it starts itching and everything, and it creates a kind of a different pathological problems in our upper jaw, this area. So what are the ethno-archaeological, or what are the conditions which might lead to these kind of infections, like inside cooking, where you are continuously are exposed to the smoke, or something related to your occupation. So the pottery making, doing dusty work, and exposing, mainly all where you have to inhale impure air. Okay, and continuously, it's not 1 day or 2 days, but continuously, if you inhale impure or part with the air, so this kind of problems can occur. Then this is called as a squatting facet. This is squatting facet is extra facet for the tibia or the lower leg. When you are used to sitting like in this posture, the bone, the foot and your lower, they come close. So therefore you are having this kind of a squatting. So this is how you can identify that this is a way for the occupation or while sitting. You can see in the villages, people are very easily, they can sit in this posture for longer time. But in today's world, we cannot sit in this posture not more than a few seconds. So this is how we can try to get the information about their way they are living. Or these kind of clavicle or the collarbone changes, or the humeral bone changes. So different activities, as you can see, you can reconstruct, or you can at least guess what kind of activities might be involved on the basis of the age and sex of that particular individual or that particular bone. So on that basis, you can identify like maybe certain activities which requires and which have been is prolonged activities which are seen. So this can be identified to the markers. So they know as a stress markers. So new bone formation, this is basically just maybe there are certain neoplastic or the new bone development within some time. These development do not have any role to play in our everyday life, but certain bones are created, like they are known as a cancerous bone growth. So this is not from India or anywhere. This is from, I got it from the Paleopathological literature. So you can see there is an extra bone growth on the face, and even in the pelvic region, the mandible, and there is a destruction of bone here because of the cancerous growth. So all those things can be identified and can be understood by working by looking at bones very carefully and try to get some information up through them. Then dental disease, again, it has been documented very well in archaeological literature because teeth gets preserved very nicely, and so the enamel is the hardest portion in your body. So so here you can see the tartar accumulation. It talks about the oral hygiene practice, or it talks about what kind of, this is very good for us in the sense if we can do the chemical analysis of this starter or this food particles, we can actually identify what kind of diet that person had. It is an individual basis, obviously, but we can actually see this is also very much very strong, very big attachment of tartar or cementum, what we call it. So you have to go to the doctor to take out the cement, and it has to, the dentist has to actually use the drills to cut. So it is like a cement. So if you don't clean your mouth for years together, so these kind of tartar accumulation happens, or these kind of attrition to the inner side of the dentition, or dental fluorosis. If there is a lot of fluorine in the water when you are drinking water in your formative age, then you get these kind of pink, the orangish stain on teeth. It is not because of, it is in the during the formation, again the attrition. So these are the caries infection. Again, it is related to the tartar. It is again related to oral hygiene. This is a periapical abscess. Again, it is related to the caries, where the pus is, this is the pus formation process has happened, and to drain out the pus, these kind of holes are created. Then these are the antemortem tooth loss, where the teeth has been lost and the bone has fused. So we can identify those when it is because of the, after the bone is, the tooth has fallen down, it has fused together. So it is an antemortem tooth loss. Then hypercementosis is the thickened root of tooth. Then this is controversial case of dental surgery, but we don't know exactly. It has been mentioned by, it is from Mehergarh, and you can see here, or maybe it's related to some kind of a toothpick, cleaning for the, just to clean. So these are the cranial shaping. It is man-made, and you can see this is how the skull, it is related to your social hierarchy. Some communities, they like lotus feet. So again, it's related to beauty standard and other things. So it is again, it's a beauty standard or social hierarchy, or this long neck current. So you are having this in Thailand, you are having the ladies with all these brass rings kind of surrounding their neck. So it looks like they had elongated necks, but basically what happens, this is an X-ray of that long neck current. So the clavicle or the shoulder goes down because of the heavy load, and this is a normal X-ray here. So you can see the angle of clavicle, and here the angle of clavicle. So it goes down. So it is again a man-made changes in the skeleton. So why I was talking about it, it is related how we can identify the coming to the topic. Like if you see the world population growth, when we talk about the semi-nomadic era or Neolithic, Chalcolithic, during that state of agriculture beginning, you see there is an exponential growth of population because of the settlement, because the people have started settling down. So there is a tendency to growing of the population, like explosion of the population basically. So you can see here there is an explosion, or the, so with the advance of the technology, you are seeing that the population is increasing, and because of the population is increasing, you are getting all these issues like change in the settlement pattern, because you when you think about nomadic hunting gathering population, like so they are in a sporadically they are roaming around, and they are not having very close contact. The groups are very small, where it is they are moving along, they are using minimized natural resources. But when you come to the agriculture, when you come to the settled pattern, then you see that the people are coming closer. So the infection rates are very high in the agriculture population or agriculture the habitation, because there is a decrease in the population mobility, and again there is an increase in population density because of the more number of population, or more number is increasing. And so there is a problem with the agriculture. So to feed these population, you need to intensify the agriculture. You have to intensify the trade network. When you are talking about trade network, you have to move somewhere, you have to invite someone. So again, the infections are coming into the society. You are taking infections to different societies. So the exploitation of new areas or the new resources. So that way you are continuously getting exposed to new viruses, new bacteria, and through that the society is kind of getting infected. And then you are having because of all these things, you are having the increased infection disease. And when you talk about the food habits also, when we compare, the agriculture production will have maximum food based on carbohydrates in comparison with the hunting gathering. They will be having more protein based diet. So when you are having poor quality food, obviously you will be malnourished. And when you are malnourished, you will get infected very easily. And when you are infected easily, whatever, even though you eat, the body is not able to digest that. So definitely it has to, they share a very symbiotic relationships with each other. And there are certain cultural induced barriers also, like certain food is not allowed by certain communities, certain things are not allowed. So the main thing is the host means basically the humans, what is the susceptibility of the, according to age and sex, which finally it reflects into the mortality rates. So that is what we get in the paleopathology. The indications of these things can be seen in paleopathology. So certain few studies I will go very quickly. I think so. I'm coming to close to the end. So as we published this paper in 2011 about how skeletons or the traumas can identify the social problems. So if the society is unstable, so you will get these kind of trauma marks or some kind of infections and other thing in a later time, during that time. So you will get, so this was documented in our this has some issues of interpretation, but as of now we can use this data to understand the societal pressures, or again the same thing, how we can identify, like the later Harappan had during the later Harappan phase, we had lot of infections, lot of diseases coming into the picture. So what could be whether it has some kind of a biosocial processes during the end of the Indus, like there is water scarcity, the population is moving and they are not able to sustain such a large population. So how the dynamics within the society change. So this way we can identify through pathology. Then again, this already I have discussed about the leprosy from India. And this is from the isotope analysis, we identify early age migration from the surrounding area to centers. So today also we see that move into the cities. So that also can be seen through the isotope analysis. Then this is DNA related to the DNA analysis, what we achieved. So there is a Parsi community called Sanjan. Excavation was conducted in 2004 and other places during that time. Sorry. And we could identify the Parsi is, everybody knows that this is a very close community. No, they don't go to marry outsider, and outsiders are not allowed inside, or they are not taken that very easily accepted in the society. But in this, we identified through DNA that there is a local population indications are seen in the DNA. We could identify that through dental morphology also. So even though DNA was not possible earlier, through the dental morphological features, we could identify that these populations share certain similarity with the local population through dental morphology. Then this is one more recently in 2019 we have published. This from Rupkund site, somewhere 5,000 meters above sea level, and there is a lake where you can see the lot of bones, and we could identify. Many people do not agree with, many anthropologists from India do not agree with the results from this particular paper, but this is published, so we will work again to clarify it. So we could identify the different populations, 3 and 2, at least 2 events of these bone deposition. So this is what through DNA we could achieve through Rupkund. Then this is something called as a dual energy X-ray observatory, or DEXA scan. So we had a DEXA scan, or the complete body scan from the Hyderabad population, and through that we could identify, as you can see, see the outline. So what we do for the stature estimation, we use Totter and Glacial formula, which is from the white male and white female. So in Indian context, we need to have our local standardized data for stature estimation. So through that, this paper, we could get certain kind of formulas to calculate the stature Indian stature estimation, which can also be used by Sri Lanka also. So this is one more, using the same database, we identify the body mass index pattern and how we can use the femur head diameter and the neck diameter to understand. So through that we could identify the diabetes, or these things can be traced back to early agro-pastoral communities. So this is a very interesting paper we published. So basically, when we talk about the paleopathology, what we should do is like establish a panel where experts to discuss about different pathologies, because it is not easy task to kind of find out the problems related to the human society, past human society, and then establishment of the central bibliography or skeletal database to know in the future, if somebody wants to work, then that person should be kind of allowed, or that person should know what kind of other studies are being conducted earlier, so that way that person can design their research idea. So these are the things we need to kind of think about when we do the paleopathology as a subject, and we have to standardize the methodology for describing the lesions. So this is really, now we are going to have a global health project coming into picture. So maybe during that time, we if Sri Lanka allows us to look into the material, that will be really good, that we will have certain standardization, because we will be dealing with the Indian skeletal material, will be having dialogues with different departments. Same way, if Sri Lanka, because it's part and parcel of the South Asia, so if the Sri Lanka can also allow documentation, then it will be really great efforts in the subject. It will be really great step into this particular subject. So so that's why, like, Sri Lanka has a very good collection from different cities, from the different chronology. So if after this lecture, if somebody really interested to carry on the research on the paleopathological point of view or any skeletal point of view, it will be a great achievement of this lecture actually. So with this, I thank you, all of you, and thank you again, State Department of Archaeology and Professor Anura Manatunga for this invitation. And if you have any questions, please ask me. Thank you so much.
Thank you very much, Dr. Veena, for your very informative lecture. And I would like to hand over the discussion part of this to Dr. Lanka Ranavira and Dr. Chamali Nahalage, because they know the subject and this is like great to me. So they will continue. Thank you, Veena, very much.
Thank you so much, sir. Well, thank you so much, Dr. Veena, for your very interesting and very informative presentation. I hope that the audience gain a lot of information from you. Yes, actually, this topic is new to Sri Lanka. Actually, there are a couple of researchers involved in this paleopathology field. As you said that, archaeology is like now it's a multidisciplinary subject. So your presentation reflect the, the how the pathology can include in our analysis of archaeological human bones. Well, when it comes to the Sri Lankan context, actually, although we have very good skeletal record sequence, which dated back to 42,000 years old, right? And we have then, of course, a skeletal record sequence like 28,000 and like 14,000 and 8,000 and 6,500, 4,500 VP and 1,500. And right now, of course, we have Vedda people who believe to have believe that they are the country Aboriginal people. So the thing is, when it comes to this paleopathology section, we have done a very superficial touch on this, and mainly focus on when I go through the Sri Lankan bones, Sri Lankan human bones, then we could identify mostly the oral pathology problems. Right. So I am sure that your presentation is a really eye-opening presentation for the almost all the archaeologists in Sri Lanka. So I would like to open the session for the questions. So if you have any question, you can ask from her.
Hi, Dr. Veena. This is Shamali Nahallage. I hope.
Yes, I remember you. Yes. Hi, how are you?
Fine. It's so nice to see you again after a long time, and also to listen to you talk. I think as Dr. Lanka told, this is a very good field that I think Professor Manatunga, I really have to thank Professor Manatunga also for organizing this kind of talk, because I know in Sri Lankan archaeology we have done a lot of other things, but I think this is the area that we have not touched much. So in this way, even by going through your presentation, what I saw was sometimes even when we look into these bones, we know that we sometimes might have misinterpreted some of the things as natural decay or other environmental decay that had happened onto the bones. But when I look into your pictures closely, so we might have overlooked some of the things. So I think it's a high time if we could revisit our bones, if Professor Manatunga's permission, and because what I gathered from your talk also that this is a multidisciplinary field with a lot of expertise need from different fields. So that is why, but I was also really interested in your talk about the things about these diseases and the nutritional aspect. And then, of course, these stress factors.
Yes.
Yes, but in your research also, have you found evidences of stress factors of these prehistoric populations, in those times, it could be not I know when you visit our lab that day, I show you some of our bones. Then when you look into the cervical vertebra, you just told about the stress that they might be carrying something heavy on That is why the cervical vertebrae are compressed like that. So it was a new way, and I was very grateful to you for that, for us to look into that side. Even I was not aware of that. So like that, in your studies also, have you, like, from your research, did you find some kind of stress factors related to these paleo?
Yes. Whatever the photos I talked about, the stress related fractures, it is from the Indian skeletal series, like the vertebral column, the problem with the vertebral column, or the clavicle, specifically clavicle, or the humerus, or the spotty facet. It is all from Indian context. So we could identify the stress factor. I could not put all the photos or all the information, but this is we generally get, because it is the body which older individual, they show these kind of markers, because the body is being used. So definitely it is very much there, very much there.
Very much there, no? And then, like, from the like the present, the sub present bones, of course we can see the lipping and osteoarthritis and all. So I'm not aware about the osteoarthritis and other diseases related to our skeleton, but it could be due to nutritional factors and other factors as well, isn't it, according to the data that you presented today?
Yeah. We actually, the thing is, sometimes because of the postmortem damage or the damaged we keeping, many things gets lost. So even though they are there, it becomes like they are while cleaning the bones or something, you can lose the many. Sometimes I have broken some bone while cleaning it, to try to find out more about. So I think so the stress factor and osteoarthritis, they are there, they will be there, according to my understanding about ancient population, or even today, like above 40, you should get stress, like the arthritis. That is what I feel.
Yeah.
Well, actually, I would like to add a few points. Actually, I have worked on one of the Sri Lankan site known as Paleopathology. So I have analyzed the pathology over the skeletons, right? Interestingly, we could identify more oral pathology. Almost all the pathology recorded related to the oral cavity, like caries, dental abscesses, antemotum tooth lost. Even interestingly, the teeth wear pattern, if you look at the teeth wear pattern, they're anterior to, the front teeth, incisors and canine, we could see even the root canals. So they have used that much, they have used the teeth that much. So already, the data presented in World Archaeology Congress, so one was in Tokyo, and also I have presented one in Jordan, World Archaeological Congress. Well, the manuscript is on the way related to that one. So actually what my plan is that, to expand this study to the almost all the other skeletons as well. So actually now we have our Director General of Archaeology, Senior Professor Anura Manatunga, sir. Yes. Right. So I hope, he will extend his full support to us. So I think I'm sure that
it's not a problem at all. We need research, and we need the world-class research, and I want to take all of you together and join together, and let's do a good work, right? Veena, Lanka, and Chamali, and all the young students should join together, and we'll form a good research team, and we'll continue that. Permission is not a problem at all.
Thank you.
It's already granted.
And shall we open the floor to the questions from the others? Actually, I have questions, so I will keep it for late. And how about the others? Do you have any questions? You can ask from Dr.Veena.
Can I ask a question?
Yes.
Yeah, I'm Anura Manatunga. And I'm really thankful for you for this interesting and informative lecture. And I also want to thank Professor Manatunga sir for giving us this opportunity. Actually, I'm not, I don't have any experience in this field. I'm a landscape archaeologist. So what I was thinking about that, you showed the skull with some trauma with the flat blade.
Mhm.
So are there any evidence on the cause for that trauma? Because why I'm asking this is that we have found some similar skull from Sri Lanka, from the Ravanala cave, in the prehistoric cave Ravanala. It also have such kind of trauma. So some hypothesize it as a ritual or a sacrifice or something. So do you have any evidence for that trauma?
That is the only case, very strong case about the cranial trauma. Basically, we have different cases of traumas, like as I showed you, the fractures and heel fractures and other things. So we have, but the cranial trauma, we have only 1 or 2 cases. And like for Rukun, I showed you that because of the hailstorm, it got fractured because of the falling of the hailstorm. So those are the things. With the particular this S. Pappinaikan Patti from Tamil Nadu. So that is why, because the kind of the bone is removed. So through that we can identify this might be some kind of a flat sword line, and the skeleton was found from the Iron Age context. So when we have Iron Age context, so we expect that they were knowing about the iron technology, and they were knowing these kind of, so probably through that context we could identify, like the, if you want I can share the paper. It is not my research.
Please.
It is Professor Walimbe sir's paper. So on that basis they identified that this has been used for the kind of some kind of a war or some kind of interpersonal violence. We cannot say war, but interpersonal violence might be there. So very few cases are being found like that.
And there's a question in the chat box. Is there any finding related to pathology in the Indus Valley civilization?
In this, yes, we have, like we have published 2 papers. So in that we have identified different pathologies seen in the Indus Valley civilization with the cultural context, like the, for example, like the later part of Indus civilization, where you are having the, kind of the Indus civilization was going down. So we have a lot of traumas, lot of infections seen on those skeletons during that context, during that time. So we have a lot of traumas. Yes, trauma as well as the infection, both.
Okay, thank you, ma'am. And there's a question from Arun Sankar. He's asking, how can one identify the sexual disease from paleopathology? And are there studies conducted on the same to understand the social impact in gender balance?
Okay, that's a very good, very strong question, actually. Gender bias, balance, and other things. Okay, so when we talk about sexual disease, means basically is asking most likely the treponemal infection. So the treponemal infection can be seen, and it is a very controversial. Earlier, it was thought that during the 14th century, with the Columbus, the treponemal infection was introduced from New World to Old World. So that is but the recent studies shows that the treponemal infection was very much present in all the communities in a different way, like yaws or pinta or syphilis or something other. So it was very much present earlier, but it got exposed by this Columbus, 14th century Columbus, right? So it is there, very much there in all over the world. You can go and check on treponemal infection and paleopathology. You will get at least hundreds of papers, not thousands, hundreds of papers related to that. And coming to the later part of the question is on the same, to understand social impact of gender balance. Yes, sometimes they have tried to identify whether it's like, for example, Pompeii kind of the site, where you are having the huge number of skeletons. So, and there they say that there is more of people were more going there for enjoyment and other thing. So you are having the triponormal infection or other diseases prominently seen on those skeletons. So definitely there is a triponormal infection. In case of triponormal infection, there is always seen in context of the gender, like whether it's a male or it's a female and why it is there and other things. So I think so I have answered that question.
Thank you, ma'am. And actually, I have a question.
Yes.
Actually, I don't remember the bone. It's related to the child one. You said that with having a TB and so on. Well, so you said that it is not yet confirmed, right? The TB?
Right, right.
Why? I mean, is there any possibility to the genetic study for that in order to get the specific primers for the tuberculosis bacteria? And then
yes, we can get there is a we can, but we haven't tried till now. Why I say, because when you have if some individual has a tuberculosis, the inner table of your ribs, they get infected because it's close to the lungs. So in this particular individual, we are not got so much very strong evidence for that. But it is not a compulsory to have that kind of that is the only way. But definitely through DNA we can. But the problem with South Asia again is the DNA, preservation of DNA. Preservation of DNA of individual is very difficult, and if you go further for the pathogen, it's much more problematic, much more. So even though theoretically it is possible, when it comes to the practicality of it, it's a problem. So we should try it. It doesn't mean that we should not try it. We should try it, but we cannot completely depend on whether we'll get positive response or positive results from that.
Yeah, actually we have tried the ancient DNA on our material also, actually from the same materials, Paleomalala materials, but unfortunately we couldn't get the DNA.
It is not possible. South Asia is a horrible place to actually.
Yeah, so that's it. Unfortunately, you know, our climate conditions are not so good for the survival of DNA. But the thing is, we have to find it out, the optimization, the PCR, and we have, you know, maybe in the future with the more sophisticated and more, more technology.
So we found at 2 sites, we found the ancient DNA, but they are of the later period. One is Rupun, which is a high altitude site. Yeah. It is, so that is a completely, and Sanjan is 9th to 11th century. So again, very late. So if we go beyond certain time, the South Asia do not allow us to do the DNA.
Right. Yeah. Okay. And
there's another one question, I think.
Yes.
They're asking like how we can distinguish natural decay and pathological condition like arthritis.
Okay, so for that you have to really get trained eye. For that you need to see how the bones, actual bone, normal bone looks like, and how the arthritic bone. Other than that, there is no such kind of tool to identify whether it's a degeneration because it has a different way of looking at the morphology of damage is very different from taphonomy and as well as to pathology. So you really has to get trained. It's not like I'm just telling just for the telling, but it is actually you need to train your eye for that.
Yeah, that's what I also like understand from your presentation. Like to start this paleopathology one, first we might have to have a good understanding of the normal conditions, isn't it?
So you should know how the normal bone look like, and then you go for the.
Like, are there, like, I know in Sri Lanka, of course, I think there's a real possibility for us to find this like normal bones and the pathological condition from the present human population. Like, are there any like kind of type specimen in India as well for these certain diseases?
So in what sense, like?
In like paleopathology, like you said, like you said in the child that it is TB. But are there any present population bones to indicate that TB in children can be seen like that? So like that kind of, yeah. Example?
Yes, we can see. We have to see. Actually, I haven't delved too deep into the subject right now. This is just an initial thing, but the present day population is always important because the X-rays and other things. So you should have parallel kind of database of the the medical database to compare your specimens. But the problem with that also, I have spoken a lot of this at this orthopedician. They are not used to seeing the bone like the way we see. So they see through the X-ray. So for them also sometimes it becomes difficult to identify. Even though we say this is this, then also they get very confused. But we should have modern database with us to compare. Definitely, this is the best thing to have.
Another thing, ma'am, I think, for the current day practices, initially the doctors are diagnosis the thing, no? So in order to, any research, in order to present in the bone, it should be more prolonged or a one, right?
Right.
So therefore, it may be a little bit difficult, isn't it?
Yes, it is very difficult. It's
working
in this kind of,
because it should be very chronic, in order to present in the bones,
yes.
Otherwise, because
you
maybe
will not get any evidences also.
Yes.
There's
but the case like a Paget disease like that, maybe can present in person. I mean, we can go for the X-rays, when we can identify, because it's like it's a metabolic disease and it can easily find it out from the X-rays and so on.
We should have a lot of X-rays actually of skull, because there is some, when we talk about iron deficiency or sickle cell anemia, so we have that hair on stand, that kind of a typical feature on the cranial bones. So if possible, you can try that also, like to do the X-ray and see whether you can have that.
And ma'am, there's another question from Aparna. Is stress factors you said about squat position bone disease? Squat position is also full body exercise and it's also a yoga position. Is it happen because of long process? Yes, I think.
No. It is not because of the yoga. It is because yoga is generally you do it for, say, how even you sit in the squatting position, it will be not more than, say, 2 minutes or 3 minutes. So when we talk about squatting facet development in the tibia, it has to be prolonged. It has to be every day and prolonged activity. Like, for example, the pottery making. If that person is sitting in that posture 3 to 4 hours continuously in that posture, so, and for like 10 years or so, or 5-10 years, so then only that tibia will develop that kind of a squatting facet, not for the yoga posture or not for the small time activity, even it is every day.
Thank you, ma'am. And
we also have another question, and she is asking to explain the importance of paleopathology for future medical field.
Future medical field means, see, if you want to know the development and how the bones react and how the society reacts to it, it will be interesting to study. As for example, like leprosy, like how the society was behaving towards the leprosy, how it was, whether there's today also we see them, we socially boycott the people who are suffering from the leprosy. So that also can be seen from there. So when we are talking about the development of the paleopathology or the changes of, because every culture has different kinds of pathologies, prominent pathologies. So if we know the pattern, if we know how the process, how the bodies or society reacting to it, it will be very useful for the future study. So that is basically the use of paleopathology in context of the today's medical science. We have to know the history to cope up with the certain things.
So in other words, we can get a like evolution of the disease, right?
Yes, it's an evolutionary process.
And ma'am, there's another question. Is there any paleopathological evidences revealed from Indo-Gigantic area valley? I think already.
Indus
Gangetic.
Gangetic.
Yeah.
Yeah,
Yes.
Okay, in this, so we have vary from the Gangetic River or the UP or Bihar area, probably that is the one I think so is they are talking about. So, and there is one question that, ma'am, we have evidence what is about the surgeries. Okay, so okay. So one by one, the Gangetic, we have only 3 sites: Sarayana, Rai, Damdama, and Mahadaha. Those are the Mesolithic site, and we have like the Kennedy has worked on those specimens, and he could identify only certain oral pathologies as it was studied long time back, and even though the studies are being done on many of the skeleton, we have to restudy those because the subject has developed a lot after like 19. If you see 1980s studies or 1970s studies and today's 2020 study, so obviously there might be certain pathologies, but we are not known about it because there needs to be restudied. So that is
right. Thank you, ma'am. And I have a question.
yes.
This is actually related to the identification of the non-specific and specific infections.
Right.
Could you please explain a little bit of that identification of specific and non-specific one?
Okay. So the specific, the non-specific, what I mean is like we can see the bone development or bone infection is there, porosity is there, in some kind of porosity is there, some kind of bone modification is there or something. So, but we are not able to identify what led to that, what particular infection led to that pathology or that bone changes. So we are not sure about the process behind it. But when we talk about the specific infection, we can identify like this bone changes or this thing on the basis of the location of the change, on the basis of the which part or which bone it is. On that basis, we can identify that this is like, for example, leprosy, or for example, syphilis or tuberculosis, or these are the bone changes. They are very severe as well as they are on particular area of the body. Like as I talk about leprosy, so the leprosy is all extremities. So if you have degenerated bone ending, so you can, or the mainly this nasal septum, that is the area where you have to look for the leprosy. So if you have degenerated modification there, so there is a chance, high chance that or the chin area, there is every chance that that person might have suffering from leprosy. So that's what I mean by specific and non-specific.
Okay. Thank you, ma'am. Yes, is there any other questions?
Excuse me. Yeah, I have a question, Dr. Veena. I'm Tarangi from the Department of Archaeology. My subject is stone tool implements. I want to know, you said that, when somebody is making pottery or something, when they are in a one posture, their bone will be changed. As like that, did you find out any evidence related to prehistoric sites? The man who was making the stone tools when they are sitting down. So did you find out any bone changes of that prehistoric man?
No, we haven't got, I don't know. But first of all, we don't have much skeletons coming from the prehistoric time, like very few. And so it is very difficult to comment on this question. But bone modification is always there. Like for example, horse riding. Okay, when you do the horse riding, your femur, it bends posteriorly. Laterally, because of the kind of sitting posture in that particular. So there might be certain, like for example, if you think there might be certain fractures or certain kind of trauma might have happened to the hands while doing the tools, or certain kinds of holding of tools and doing, but I cannot confirm it because we don't have that much evidences right now here with me. So I'm sorry, I cannot help you other than that. But you can find it. But you can find out about if you find any skeletons out there. So you can try to find out certain markers, maybe in the hands or maybe in the feet area. So which can be helpful too for your understanding.
Okay, thank you very much.
Yeah. Thank you.
And another thing that you mentioned that you have already formulated the formula, right, for the
Yes.
stage calculation, right? So it's ideal because still we are using the European
Yes.
formula, and also that's ideal. And now, of course, we are working on the Sri Lankan population and as well. So what I'm thinking is I will get your data and I will put and I will try to
Yes,
compare
yes.
the Sri Lankan
If you can
population.
share your mail ID with me, I can send you that paper so that it will be.
Thank you so much. Thank you so
Yeah.
much. I can refer that one.
Yeah.
So I'm sure that in the future we can do many more research.
Yes, yes, I would love to, because Sri Lanka, I like Sri Lanka a lot. It's a
Thank
really
you so
hospitable,
much.
yeah,
Really,
hospitable country. And Dr. Anura, like Professor Anura, is really welcoming, and
he's an
so,
exceptional person.
yes, so it will be good to be back in Sri Lanka.
And ma'am, there's another one. That person is asking, there is an important place look like the Sigiriya in India. If you can opportunity for give you an opportunity for me, I can explain that one. Yes, of course, Mr. Asela Kumarasiri. Yeah, you can.
Actually, probably he is meant for this Ajanta and Ellora. Ajanta. We have Sigiriya.
I think it is not related to your topic.
Yeah. Yes.
I see. Okay.
Yeah.
And,
we can
also
this discussion later on. I think now it's almost 1.5 hours will go on.
Yes,
yes. What we can do is you can form a study group.
Yes,
yourself.
that will be good. That will be good.
Yes, that you can do, and you can join our lecture series also. And it would not be on the same topic next time. It may be some other topic. But your people, you can keep in touch each other, and you can come to my department also. My department is open for researchers, and our library and all the facilities are for you only. And let's do a good job, actually, right? So,
yes, definitely. You are there, so it's really good.
Yes, and now the other thing is I need to train some young people. So that you could help us. I already talked to Chamali and Lanka to train some of our young students, because we need more Veenas.
Yes. Thank you. Thank you for the compliment.
Yes. And then
more smiling Veenas.
Yes. I know.
So I would like to invite Chamali to do a vote of thank or some kind of vote of thank for Veena, and then we'll meet some other time again.
Yes, definitely. Thank you.
We'll have an international lecture on international seminar on this, not webinars. Webinars are headache now, but international interactive seminar on the same topic after this pandemic days. Right?
Yes, definitely. I would love to come back.
Yes. So we'll join together and we'll have a meeting some other time, right?
Yes.
Tamali, can you wind up this?
Yes, so I would really like to thank Dr. Veena, the smiling Veena, as Manatunga said. I know, like from the very first time we met you, like we know your capability, how good you are in your area of study, and how willing you are to like give your knowledge to the other. Always very helpful. So that is one of the best qualities I have seen in you. And I think that is what you have done today to all the, I think we have earlier, when we had the talk, there were about 95, close to 100 sometimes participants. So I think that is why.
It was over 100 sometimes.
Oh, yes, that's why. So that is why I think you really gave good knowledge. And like to the audience today, and which is very important because this is a really important and a new field to Sri Lanka. So so I think in that way, it'll be like the people who join today, I think they will be thinking in a new way of looking into the bones that they are coming across from now onwards. So thank you so much for giving that exposure and that bit of your experience. I know this is not enough time, and we are really sorry to see. I was really thinking, okay, now it's almost over, but there's still more things that we can learn.
Yes.
So I really hope Professor Manatunga will invite you when these things calms down. So because it's as Professor Manatunga will be very important for the young archaeologists, and not only archaeologists, for everybody, as he mentioned in this, he has formed very important forums like Archaeology Youth, Friends and Kids. So your contribution will be immense, I think, and we are all looking forward to.
I would like to invite Chamali and Lanka to join our Archaeo Friends Society.
Yes, sir.
Thank you, sir. Thank you, sir. Thank you.
Veena can't join it because she has another forum, IAH. But you two can join us on Archaeo Friends, right?
Yes.
I'm so sorry that you can't join Archaeo Youth.
Yeah.
No. Why? This is wrong.
You can be one of the Archaeo Friends. Thank you.
Okay. Thank you
so much.
everyone. I hope we can have some kind of a workshop for the Lanka, Dr. Lanka, Dr. Chamali. We can have kind of a workshop if.
Yes, that would be ideal. Thank you so much. Yes.
Yeah.
Now 5 workshops are going on. So therefore, let them go a little bit ahead, and then we'll start workshop on bones.
Yes.
And one by one we'll go. Otherwise, it will be like, I mean,
yes.
It's very difficult to digest then.
Thank you so much. Thank you so much to everyone. Thank you.
Thank you so much.
Yeah, so on behalf of all the participants today, I would very heartily like to thank you for your time and for your contribution to this seminar. Thank you so much.
Thank you. And
Good night
to
Good night.
Good night to everybody.
Good night to all.
Good night to all.
Yes.
Yes.